What's up, everybody? Welcome back to another episode of Outside the Box Conversations, and I feel very lucky to be with you today. Did you know that?
You should. No, I'm just kidding.
Guys, we caught Jasmine in between appointments. This, of course, is Jasmine Allmon from our Knoxville office. She's our esthetician here. We're inside the Knoxville office. We're in a tiny studio, and we're making the most of it.
We're making it work.
There's making it work.
A lot happening today. It's a busy Friday here in
Yes.
the Knoxville office, but we're making it work.
It's a Friday when we're recording this, and wherever you're listening, we appreciate you guys being here. We're going to learn a little bit about skincare today, and I specifically had some microneedling questions. So,
Did you?
Yeah, I always have some microneedling questions in the back of my mind.
Okay.
So I'm just going to shoot from the hip, and why don't you just tell everybody watching, what exactly is microneedling?
Okay, so for those who don't know, microneedling, or otherwise known as collagen induction therapy, is that it's a way to introduce collagen production back to the skin. It helps to fill in fine lines and wrinkles, acne scarring. It helps to refine pore size. It is introducing little microchannels, so it's almost like a dry needling of like tattooing with no ink, so to speak. So we use a pen with cartridges, and they have about 12 needles in them, and they're moving and they're poking little holes with, again, like it's like tattooing without the ink. We numb you first. It's very comfortable, very what's the word? Like, a lot of people can do it. It's not uncomfortable.
It's not
scary. Don't let the needle scare you, because a lot of people get intimidated by that, but it's not bad at all.
So
totally worth it.
Why would somebody want to like re-injure an injury? Because that's kind of what you're doing. Is
yes.
the needles are, you're poking past certain layers of your skin to
past the epidermis.
Cascade.
Past the epidermis, so it's going down into the dermis, the layer beneath your top layer.
Yeah,
and that's where introducing that injury will induce the production of, your body's going to heal itself. That's what we're doing. It's controlled trauma. It's a controlled injury so that your body can do what it's designed to do, which is repair itself, bring that collagen back to the surface, and fill in the fine lines and wrinkles, rejuvenate and repair the skin.
Why would people want to do that in terms of, like, say I have wrinkles that I want to get rid of? When would somebody want to choose microneedling versus, say, Botox? Or is it?
It's both.
Okay.
They work in perfect harmony together. Andy and I had to explain that to one of our patients recently, to do a series of microneedling first, then to introduce the Botox and the filler, because it all works together. One is kind of working from the outside in, and then the opposite way for the Botox. So they work in harmony, both together, depending upon how deep your scarring is, how deep your fine lines and wrinkles are, will determine which one you need more of. But they both work very well together.
Where are you seeing the best results in terms of, like, where you're using the microneedling? Is it all over the face, or are you focusing on certain parts of the face?
It's case by case. I have patients that have what we call ice pick scarring, which means they suffered from really bad acne and they picked. And so it leaves these little mini craters within your face. And so some have deeper craters than others. So for them, it's wherever their trauma was, wherever their acne scarring is where we're going to see, the most result, because that's the area we're focusing on. Most people who don't have that issue, if they just find lines and wrinkles, if they're just aging, just like everybody is, the first place you usually tend to age is right around your eyes, your forehead, and around your mouth. So
if I'm somebody who is only getting Botox, but also want to take advantage of the microneedling and what it can do, you're saying you get the microneedling first, and then you get a Botox treatment a couple weeks after? Is that kind of the...
So it depends. We market them as a series. So some people, depending upon what you need, is about 3 to 6 treatments. We sell them in packages of 3, and that way you get it discounted. It's way better to do it that way. You need at least 3 to really see optimal results. And then from there, you can decide, do I take a break? Do I need to go ahead and get Botox, wait a little bit after that, and then reintroduce another series? It just depends on how deep your wrinkles are, what your skincare goals are. So it's a case by case.
Do you start seeing the results after 3 treatments, or do you immediately see them after the first one?
You see the optimal results about 6 weeks after the 3rd treatment.
Oh, nice.
It takes a while, but it's worth it. It's slow and steady wins the race. Your trauma didn't happen overnight, and the results aren't going to happen overnight either. So
now, I know we're jumping around here, but I know that there's some things you do with microneedling, and specifically ontogeny C. Is that a treatment with microneedling, or is that completely separate?
So we partner it here in the Knoxville office. We partner it with our collagen induction therapy. It automatically comes with ontogeny C, and what that is, it's a pro serum. It uses human growth factors to help speed up the cell turnover rate. Your downtime is less, and your results are much better. It kind of replaces what some people refer to as PRP. The plasma. It's that in a bottle. It's that without the blood draw, without the spinning. Out of the platelets, it's there and ready to go, and it gives you those expedited results as opposed to just doing microneedling by itself.
Interesting. Is that something that you've seen really like enhance the results from microneedling?
Night and day. 100%, yes. Ontogeny C, I know they also have a shampoo. They have other growth factor serums to help with cell turnover. So the pro serum that we use specifically absolutely drives those results up 100%.
Now, I know people are gonna ask this, so I'm gonna go ahead and ask you: how long is a treatment? Like, what's that process like? Is it 30 minutes, an hour?
We block off about an hour. That's more or less for the a lot of time to numb, which you want. So you'd be grateful for that. But numbing is really what kind of takes the longest, and then after that, we just go for it.
You put the needle away.
Mm-hmm. We don't need to get right into it.
We don't need to be scared though.
No, not at all.
Okay.
Mm-mm. That's why we numb you for about 20 to 30 minutes, and then some people fall asleep. It's easy. Quick and easy.
Is it only for the face, out of curiosity?
No, there's people that use it on stretch marks, on loose skin, and different areas of the body. You can definitely use it in other places other than just the face. A lot of men do it on the scalp. And I'm pretty sure Kelly does that in the Kingsport and Johnson City office.
I haven't thought about the stretch marks because we deal a lot with, as you know, weight loss in this office, and I would imagine there's scarring is a big issue with that. So that's something that could actually help with that.
Absolutely.
Super interesting.
It's pretty cool.
Jasmine Allmon, this has been a blast.
That's me.
Guys,
come see me.
This has been Outside the Box Conversations. This is Jasmine Allmon in our Knoxville office. Come give her a visit. Esty Bestie on Instagram?
Esty Bestie Jazz.
Esty Bestie Jazz.
Mm-hmm.
You know what? We're going to put that on the screen right now in post-production. Esty Bestie Jazz right there on Instagram. Follow her along. Her stories are pretty hilarious. I love them. I'm on one of them. My back is actually.
We weren't supposed to tell anybody that was you.
Oh, gosh.
Well, now you know.
Well, now you know. That was, in fact, me. I totally forgot that we
weren't telling anybody.
I
didn't. HIPAA violation. I didn't say nothing.
Well, you know what? If you guys made it to the end of this video, you deserve to know. You deserve to know. But we appreciate you guys. Jasmine, this has been a blast. See you guys.
Don't go away.